Herpes infection is a permanent infection that stays in your body for the rest of your life. That was so dramatic. Hello, my name is Pharmacist Evelyn and you are welcome to this channel, Immune_Lifestyle. Here on this channel, we talk about health and also remedies to some health challenges. If you're a new subscriber, you're welcome. Let's like, let's share, let's comment, and let's all engage on this channel. You're welcome. Okay, so today I'll be talking on herpes infection. Well, herpes infection is known as herpes simplex virus, HSV for short. Now, this infection is a viral infection that affects both the oral and the genital area. And in as much as there's no cure for this infection, there are certain measures that could help to elevate the pains and blisters that comes with this infection, and also reduce the transmission from one person to another. Many people have the asymptomatic virus, which means that they have this virus, but they never have an episode or an outbreak of the infection. While some other persons, they usually have occasional blisters and so outbreak of this infection. Now, HSV appears around the genital area, the oral area, which includes the mouth, the lips, and also on the face and also fingers as well too. HSV can be transmitted sexually, then also through skin-to-skin contact and kissing someone that have the active outbreak of the infection. Now, because this virus does not survive out of the host, you can't contact it through hugging, coughing, or sneezing. There's HSV1, which is the oral herpes, and HSV2, which is the genital herpes. But today, I want to talk about the oral herpes. Now, oral herpes is also known as cold sore, or the one we usually know as fever blisters. These occur around the oral area, the lips, even on the face too. Now, oral herpes is contagious. Especially with people that have the active infection, it's contagious, but treatment can also help to manage this infection. There are two types of HSV. The first time you have a cold sore, symptom may not occur for up to 20 days. After a sore can occur several days, then the blisters can take 2 to 3 weeks before it gets healed. And as I mentioned earlier on, that once one have an episode of this viral infection, the virus stays dormant in the nerve cells. There are some risk factors that actually reactivate this viral infection. Number one, sun exposure. When one is exposed to too much sun, the person can come down with this infection. Then number two, cold or fever can also be a risk factor that can reactivate this infection. Then number three, people living with HIV or AIDS patients, they can also have episode and outbreak of this infection. Then number four, if you're immunocompromised or if your immune system is weakened, one can also come down with this outbreak and this infection. We have stages of this cold sore. Before it comes to become a blister, a sore, and all of that, there are stages in which it comes. Stage one is the tingling and the itching stage, which occurs about 24 hours before blisters erupt. Stage two, the blisters is filled with fluid. Then stage three, the blisters burst, ooze, and form painful sores. Stage four, the sores dries out and scabe over, causing itching and cracking. Stage five, the scabe falls off and the cold sore eventually heals. Medications that can help to speed up the healing of this viral infection. And one other thing is that once you notice there's a tingling or there's an itching around your mouth area, you just start up with the medication as soon as possible. So antiviral medication to use, we have the ointment, we have the Aciclovir, we have Penciclovir, we have the Penciclovir. Can be used on the lips if it appears around the lips or around the mouth area. Now, one thing about ointment is that it becomes more effective. It becomes more effective when you start on time. As I said earlier on, when there is a tingling or a burning sensation around those places, you ensure you start on time so that it could be very, very effective. There are also antiviral medication tablets that can be used as well and can be obtained by prescription. Then there are also home remedies that can also use to not necessarily heal the sore, but they help to ease discomfort. Number one, we have petroleum gel. I don't joke with this. Now, petroleum gel, also known as vaseline, is a very, very potent gel that can be used to ease the discomfort and help serve as a protective barrier to any external irritant. Then number two is witch hazel. Witch hazel oil is an astringent that helps to dry the sore. The next is aloe vera, either the gel or the lip balm. We all know that aloe vera have a cooling effect, so it can help to cool the sore. It can be used 2 to 3 times a day. Then next is apply ice pack or a washcloth that is soaked in cold water on it to just have a cooling effect on the sore. So please, I want to advise you don't go around kissing, especially babies, children. Their immune system are not so strong enough to fight any infection. So this HSV it's common. You might not even know if you have it. That's the funny thing about HSV. You might not know if you have it, and except, as I mentioned, the risk factors that could actually reactivate this viral infection. I hope you find this video very helpful to you out there. Thank you very much.